Dear Chairman, thank you for the invitation to present at EBC 2021 meeting. The title of my presentation is CT bifurcation score as a novel tool for predicting intraprocedural side branch occlusion, which is actually the first presentation of two sets of presentations. I have nothing to disclose. There may be two major issues in bifurcation PCI. The first is it worth to treat side branch? Second topic is how to predict and treat jailed side branch before PCI, not during or after ballooning. In this first presentation, I'd like to introduce CT bifurcation score, which was made to predict loss or jailing of side branch before PCI from coronary CT image. CT bifurcation score was derived from a small single-center registry using 260 bifurcations. There was no significant differences in clinical characteristics between 40 patients with side branch occlusion and 206 patients without occlusion, except higher elevation of post-procedural CT-MB in side branch occlusion group. In per bifurcation vessel analysis, regarding angiographic characteristics, the reference diameter and minimal luminal diameter of both main and side branch were smaller in occlusion group compared to non-occlusion group, but there was no difference in the bifurcation angle between two groups. Therefore, the main branch side stent diameter was slightly larger in side branch occlusion group compared to non-occlusion group. The plug characteristics analysis is quite complex. In brief, bifurcations with some complex plaque such as calcified or low tension plaque in main or side branch, or bifurcations with smaller side branch compared to main branch, tended to lose side branch after main branch ballooning or stenting. We did lots of regression and found 4 parameters that can predict robustly side branch occlusion during PCI. We developed the CT bifurcation score, which calculates the risk of side branch occlusion based on the presence of calcified plaque, low tension plaque, the length of side branch plaque, and the ratio of main vessel to side branch vessel area. The sum of these 4 points are the CT bifurcation score. A case of intraprocedural side branch occlusion. In this LAD diagonal bifurcation region, there's a large amount of low density plaque and calcification spot in LAD. After stenting of LAD, although the diagonal branch was protected by a wire, the diagonal branch suddenly disappeared. In another case, there's a large amount of low density plaque and several calcification spots in LAD and diagonal branch. Although the diagonal branch was protected by a wire, after stenting of LAD, we lost diagonal branch. The performance of CT bifurcation score for predicting side branch occlusion was much higher, C-statistics of 0.75 compared to angiographically derived scores, median accreditation, or reserve score. Take-home messages from this CT bifurcation score is shown here. Side branch jailing can be predicted by assessing the CT bifurcation score, which is based on the characteristics or size of plaque, including calcified plaque in main vessel, low tension in main vessel or side branch plaque length of more than 5 mm, or smaller side branch compared to main branch, defined by area ratio of more than 4.3 or diameter ratio of more than 2.1. Thank you for your attention.